Americans take 80% of the opiates in the world, yet we are not the healthiest people in the world. And you think it's okay to prescribe these things? You're a sociopath. This is how you build a person up when they're getting better instead of breaking them down when they're getting better.
You help hundreds of thousands of people. How do we turn it into millions and billions?
We just keep going. The first thing that I think we got to stop doing is telling people how bad opiates are, instead of telling them there are many alternatives that can help them. Americans take 80% of the opiates in the world, yet we are not the healthiest people in the world. That is enough data for me to say opiates are the wrong mechanism of pain relief. I also know personally many families that have dealt with deaths that were premature as a direct relation, nothing else, no other factor than opiate concentration.
I can feel your intensity on that.
It gets me, man.
That's heartbreaking. It's heartbreaking.
So our job as doctors is not to be right, number one. It's to be useful. When you're a doctor, you have a very functional brain. Especially if you were able to go like the MD-DO route. You were able to pass your MCATs, you were able to get through school, you're able to probably get through residency. You have a brain that is capable of truly learning. If somehow you have that brain and you think it's okay to prescribe these things, you're a sociopath. You know how much you know about the body as a doctor, and you're prescribing the most addictive chemistry in the world. You're not on my level. I don't want to talk to you.
And my definition for that version of sociopath would be you're a burnt out, overwhelmed, overscheduled, trapped brain. Yeah. You can't reconceptualize, I got 5 more years. Like I can't see myself retiring. I'm going to doctor until the day I die because I love the model we have learned from Stand on the Shoulders of Giants, and we just want to keep improving that. Yeah. And making it better and better and better for the patient. Because if you're doing that model, you're not getting the inspiration of results. When you work with Alan, like you said, then you said, I'll beat you because it's good for me.
It's wonderful.
I get it. Yeah. Like when you get to see.
And by the way, I don't charge people like that. That's not who you don't make.
Yeah.
Being a doctor is a title, it's a process, and it can be a living for a lot of people. But a lot of people that become doctors stay broke their whole lives. They're in debt their whole lives. Like, it's just a title. And just like anything else in life, it's what you do with it that makes you good, bad, indifferent, whatever it is.
Yeah.
I mean, if you're a doctor and you're being fed your information and not really independently thinking about it before you then feed that information to others, you probably shouldn't be a doctor. And if you are a doctor, maybe you shouldn't be a doctor treating patients, because if I'm sending my family to you,
in the trenches.
If I'm sending my family to you, if my parents go to you and they give you this complex history of pain and you address it with a chemical that is A, brutal, B, dangerous, C, overprescribed in America and not utilized in other countries, we got to have a serious conversation. And you're not going to have it with me, and I know that, but I wish you would. And I'm not going to threaten. I'm not going to get even angry. I'm just going to try to question what you're doing. How do you do that? How do you sleep at night knowing what these things cause? Knowing that.
Well, and that's where I think like compassion and forgiveness is, I need you to roll up on those doctors and say, hey, there's a better way.
Yeah. Well, that's what we're trying to do.
And when you do that, just like when your TEDx, when you had everyone stand up and do the founder, there's a couple moments where they shine on the crowd, the camera goes to the crowd, and you can see people have hope and a little glimmer of relief. Totally. That's it. And I feel like what's so amazing about foundation training is you get some glimmer of, oh, there is a better way. Oh, there is hope. Oh, my body could cooperate. Oh, I'm getting a user's manual. I'm getting the keys to my physiological biomechanical castle right now. And I feel like there's so many layers to the healthcare problem that we need to plug foundation training into. But in Boulder, Bill Blanchette, my senior sensei on things like preventing heart attack and stroke, he's one of the last privately owned private practices.
Wow.
He's one of the last autonomous medical doctors in the city of Boulder. The hospital is buying up everyone's practice, and everyone is moving to a paycheck instead of an ownership where they have flexibility, where they could be nimble, where they could go to a weekend with you and go, okay, we are totally reinventing the model for musculoskeletal pain and pain management. And that's what the old country doc used to do. They used to say, okay, there's a better way, and I'm going to introduce it to my clinic on Monday. The buck stops here. I don't worry about ever becoming an opioid addict because I'm just scared of the constipation. Like, when people come in on opiates,
pure dissociation.
I'll be like, wait, you pooped last Wednesday? and the toxemia that creates from a liver gallbladder not firing an intestine and triggering that poop. But what's the future? How are you gonna disrupt conventional pain management? Because I see you're literally like, you help hundreds of thousands of people. How do we turn it into millions and billions?
We just keep going. And I am one of many in a field of pain management that is trying to do alternatives. Now, I do not think that somebody should have a voice in this unless they have a legitimate alternative. If I was, God, I love chiropractic. It's my education. I love it. It's my home. It's where I rooted my knowledge of how the body works, and then it's where I grew from to understand how I could work in that world and help people. But if my ability to help people existed only in the passive treatment of chiropractic, I would never say a damn thing about opiates, because I wouldn't have a strong enough, try this. This is how you do it. This is how you build a person up when they're getting better instead of breaking them down when they're getting better. This is how you make it a healthy thing for their family instead of a potential lethal thing for their family. This is how you tell that person they're worth not giving up on instead of literally telling that person everything's out of their control and only a pill or somebody else can help them. There's just an autonomy that needs to be discussed. And if you want to know the future of medicine, my hope, what I'm working towards, what people that I surround myself are working towards, is that the 35 or 40% of the population that desires to be healthy and is willing to put the effort into it has all the tools they need to do so. So much so that they begin to bleed into the 65% of the population that doesn't. It's the opposite of herd immunity. It's inspirational capacity, showing people how easy it is to actually get yourself out of the current that is going towards disease and get yourself into the current that is going away from it towards health and vitality, not with expensive supplements, not with, you don't have to be rich to do this stuff, man. You can be barefoot and naked.
Yeah.
Most of the things that help our body are found in nature. Most, not all, but most of the things are found within us or can be used by our bodies. I mean, Tylenol is a breakdown of the endogenous cannabinoid system. That's how it works. Like, there's these natural mechanisms we have within us that once unleashed, they really do create a slew of pain relief, of hormonal improvement, of everything from I love myself to I hate myself. That spectrum exists hormonally and is governed by what we do. The decisions we make, the practices we have, the movements we make, the people we surround ourselves with, the amount of sleep we get at night, and the stuff we put in our body. You still take Advil every day?
Totally.
What are you doing that for? There's so much better alternatives out there.
Yep.
So that's why I do what I do. I think that the future of medicine is going to go through a big arc of frustration. And out of that frustration, I really, truly, truly hope that the coming generations see the value in taking care of themselves.
And it's going to be patient-driven. It's going to be power to the people who are saying, I want a better way.